Hi everyone, my name is Tori and I'm the head of Synopsis Projects, and we're here today with Rachel, who is the pre-assessment lead at Worcestershire Acute Hospital Trust. Thank you, Rachel, for joining me. And I'd like to talk to you about the implementation of your digital pre-assessment pathway last year. But first of all, Rachel, if you could introduce yourself a bit about your leadership role within Worcestershire pre-assessment.
Hi, Tori. Thanks for having me. I am the lead nurse for pre-op assessment at Worcestershire Acute Hospital Trust. We provide pre-op services for our general anaesthetic patients across 3 sites within the hospital trust. So we're geographically spread out. I've got a cohort of 35 to 40 nurses, all providing pre-op assessment for patients.
Perfect, thank you. And what was your driving change last year that pushed you to change to a digital pre-assessment of Synopsis?
We identified through theatre utilisation work that we needed to get better at our pre-op assessments. We needed to increase efficiency without necessarily increasing costs or reducing staff. We wanted to provide a better service so that patients weren't on the waiting list for a year only to be told they weren't fit for surgery, and enable us to reduce the amount of time we spend pre-opping patients.
And I appreciate we went live, well, the 6th of Feb 2020, and then COVID hit and the world has changed a lot since then. But are you able to say what a normal day in pre-assessment looks like?
So currently within pre-op assessment, I allocate 1 or 2 triage nurses a day. We're not having any footfall through the hospital, so patients complete their questionnaire at home. This is then sent through to us, and my triage nurses review the patient's questionnaire that they've been sent through. Following this review, they identify if there's any issues with this patient, whether they need referring back to their GP, whether they need referring to the anaesthetist, and then with the information provided, they decide whether they are for a 20-minute appointment over the telephone or a 40-minute appointment over the telephone, or whether they require a face-to-face appointment because their needs are more. We also have patients that may not need to come in to see a trained nurse, and they're sufficiently fit enough that they can come in for a support appointment for our healthcare assistants. This means that they have a very reduced time in clinic, and it frees up my nurses to see the people who they actually need to see rather than those that they don't.
And it does sound like the digital pre-assessment at Synopsis really changed your pathways, really was a transformation project. So is there any advice you would like to pass on to anyone embarking on a transformation project like this, like the key players that you suggest, or things that need to be in place before starting this project off?
What I would say is have your clinical lead on board, get buy-in from the trust board. We implemented this project through a theatre utilisation programme, and all the surgeons got involved and were really keen for this to go ahead. Get your staff to mould how your pathway will look. We did workshops, didn't we, with the staff, and they all had a bit of an input into how it was going to work and how we were going to use the system, where we were going to record things, where we were going to put things, and how that patient would move through the pathway so that they were comfortable with the change. And then I think the most important thing is we wanted to put patients first, and I shared our vision and that certainly focused the staff to accept the changes that were needed.
Thank you, Rachel. So congratulations, Rachel, on a brilliant first year of digital pre-assessment changing within Worcestershire. And thank you all for listening to our little presentation. Thank you. Bye.
Thank you. Bye-bye.